I think that video is so um, illustrative of what goes on in healthcare now. We have this young new physician who has just gotten out of school, and he is eager to take action and to not just kind of sit back. And then you have the older, more experienced physician who is able to look at things a little bit differently. So I think this is a great clip of the dichotomy between older and newer physicians. Now, for many of the conditions that a physician faces, there's no clear definition of disease that gives you an unequivocal, no question guide to action. There is a wide room for differences of opinion and variations in practice. Our text even outlines a study that was done on children and tonsillectomies, which is extremely interesting. They surveyed 1,000 children. 650 of them had already undergone a tonsillectomy. That left 350 who were then sent to a group of physicians for examination. 150 of those were given tonsillectomies or recommended for tonsillectomies. The remaining 200 were sent to another group of physicians to be examined. 92 of those were selected for the tonsillectomy. The remaining 108 were then sent to yet another group of physicians, and 43 of those were selected for surgery. Only 65 children out of the original 1,000 were not eventually selected for surgery, just 7%. So I think that is very indicative of our state of health care. Uncertainty is the main problem in health care. The case in the text about the young girl who had the blister on her foot from dancing at the wedding, and the doctor was concerned that she had necrotizing fasciitis, and he wanted to explore that, but he thought maybe, that his analysis was being clouded by the fact that he had recently lost a patient to necrotizing fasciitis. And so he called in the surgeon, and they ultimately didn't think it would be, but they went ahead and operated. And if you make sure you read this, because it's really interesting. And they got in there. This was a young, healthy 20-year-old girl, and they had to tell her, if we find it, we may have to amputate. And they go in, what looked like a normal cellulitis blister was necrotizing fasciitis. They were able to save her leg after, I think, 4 surgeries. But, had they taken a conservative approach and not done the surgery, then she probably would have lost her leg and probably her life. So it's that indecision that is a problem. When you look at the choices, it becomes an issue about whether to act or not act, okay? Not ordering a test, not giving an antibiotic, not taking a patient to the OR is far harder than choosing to do it, okay? If you looked at these decisions using a decision analysis approach, which is something that's common to business and to the military, taking an invasive step such as surgery is not the logical step to be taken. If you really take that time and chart out the decision analysis, which makes us think that maybe all of the money that we pour into research and development for new drugs, new surgical procedures, maybe some of that should go to actually researching how physicians make everyday medical decisions. Another interesting concept of modern healthcare is that the cost of healthcare has actually doubled with the rise of insurance coverage. Okay, before health insurance was as widespread as it is, and I realize not everyone has health insurance now, but many more than had it in the recent history. When patients paid for almost all of their health care, the medical economy, it behaved very much like the rest of the economy. The medical prices rose or became much larger than the general rate of inflation, and in 1950 the average hospital day cost $7.98. By 1960 it was $16.46. By 1970 it was $53.95, expanding rapidly. Okay, there are currently three main issues with regard to health care. Access and or at least health care insurance coverage. Access and coverage, quality, and cost. Access is not just a problem of being without health insurance, but it also involves the issue of being underinsured. Many have insurance, but it's not enough. The supply, the geographic location of the healthcare providers is also an issue with regard to access. These problems have created such a crisis in our hospital emergency rooms. People are using ERs as basically a doctor's office because it's the only way they can utilize the benefits that they do have, the coverage that they do have. As for quality, there's still issues with patient safety, with patients receiving the recommended care, with variations in intensity and outcomes of treatment. For example, and this is surprising to many, infant mortality rates in the United States are higher than many of the other industrialized nations, and those nations actually spend less on health care than we do. With regard to cost, employers are usually the ones who complain the most loudly about rising cost for health insurance. But in reality, those costs don't come out of their profits, their corporate profits. They have passed those costs along so that they've been incorporated into the employee's salary and benefits package, which has resulted in a relatively flat wages for the last 30 years. This brings us to now and to the current issue of health insurance coverage and the Affordable Care Act. There's two selected readings that I've given you from the text with regard to the Act. The first is clearly written by a conservative. He has a very conservative approach to the legislation and its issues. The second reading is a little more even-handed and unbiased, but it still points out the issues that are facing the implementation of this act. We will visit the act again later in the course, but this introduction should allow you to see the issues that we are currently facing in healthcare and to help you better grasp the themes that we're going to be studying over the course of the term. Okay? I hope that you will be able to look at healthcare in a different light after this semester. As I said earlier, there are many misconceptions. You're going to go into this class thinking one thing, and I hope that by the time we finish, you maybe are thinking another, or at least exploring that there's more than one opinion, that it's not quite as clear-cut as you once thought it was. So I look forward to a great semester.